Thank you for joining us today. So we have a mixture of people here in the room, and we've also got people who have joined us online as well, who we can't see in the room, but they are there in the background and they can hear us hopefully through the owl. And we've got here, I'm very pleased to welcome Emilie Smith and Yvonne Howard, who you will hear in the room, but we might not be able to see her in the room, and everyone online will be able to see and hear her as well. So I'm very pleased to welcome them here today to talk about equality, diversity and inclusion in public involvement. It's the first of our series of seminars that we're going to be holding over the course of the year around public involvement in research, which is part of our funding scheme that we're running called INSPIRE Portsmouth for the Medical Research Council. So you'll hear a little bit more about that today as well, as we talk, alongside how we can get better at doing EDI work when we do public involvement work. So I'm going to hand over to Emilie now. Thank you very much, Emilie.
Thank you. Excellent. Yvonne, did you want to kind of introduce?
Hello everyone. It's so good to see quite a few of you online this afternoon, and I'm sure there's quite a few people in the space alongside with Emilie. So just to do a quick introduction in terms of who I am first, I'll then hand over to Emilie and then maybe just set out a few, I suppose, ground rules, dare I say. So I'm Yvonne Howard and I'm the Director of Student Racial Equity. I work predominantly within student services. I am very much around really looking at parity in terms of access, experience and outcome for students. At the moment, my focus is primarily on PGM students, but also the intersectionalities in terms of identity as well, which is really crucial to understand because the outcomes can be different when we view that through an intersectional lens. So I'm going to pause and hand over to my colleague, Emilie, who I work very closely with.
Perfect. Thank you, Yvonne. So yes, I also work in equity, diversity and inclusion, as Yvonne said, alongside Yvonne. I am based in HR though, so have more of a kind of work where work impacts staff, particularly, so staff, colleagues, and as part of that would be those that are employed to do research as well at the university. This is something we've been working quite a while, I think, Yvonne and I together, in terms of trying to make it as easy as possible for people to consider other people and people that aren't like them, people that don't have the experience that they do when trying to engage with communities. So hopefully there'll be some interesting takeaways from the presentation. I will say that Amy's on the chat, so if you're online, I don't know if there's a lovely owl looking at me, but if you're online, please do use the chat because we do want to have some questions. It is not a lecture, it is, you know, for you to ask us questions as well. We don't have all the answers at all, and it'd be really lovely to understand some of the examples or some of the experiences that you've had, maybe that have worked well, that haven't worked well, and kind of maybe where we could think about making those a bit better. So let me just, there's so many things on the screen. So first off, what is INSPIRE Portsmouth? We just thought we'd take a couple of seconds just to, for those maybe that have joined that aren't too sure, but it's a pot of, it's a scheme that's funded by the Medical Research Council. It supports researchers to co-create, and I think that's really important. It's that co-creation. I think we'll talk about that a bit later on in terms of how you can really make sure it is co-creation. Proposals, so high quality research and proposals, funding, recruitment facilitation, and time of public involvement managers. So anybody can apply in terms of UOP researcher, staff or registered PGR student at any stage. It's about collaborative bids as well. So again, what does that collaboration mean? How do you know that you are collaborating well with groups that maybe usually don't have access to space? It funds that recruitment, and that recruitment could look very different depending on what types of groups you're trying to access. The facilitation, and again, it depends on the research and who you're trying to do research with, that facilitation might take very different forms as well. There's some kind of amounts of money there, and the applications are assessed by a group of by a panel of public involved members. And I think it's really important, that somebody's going to be looking at these. And we've tried to use language that is consistent with kind of work that INSPIRE is doing, so that you have that language. And that is, I suppose, an example of how Yvonne and I are trying to be inclusive and make sure that, what we say kind of means something to you, rather than trying to get you to adopt our language. So yes, Yvonne.
Yeah. Great. So, and just to say, I can just see, John, you've raised a hand and you have a question. So please do add that question to the chat so we can respond to it and build it in as we move along throughout the presentation. So thank you for that. And just to sort of build upon what Emilie has said, I think it's sort of worth also thinking now predominantly about the picture in terms of why is there, I suppose, a need for us to focus specifically on inclusion, and what does that mean in terms of inclusion in research? And one of the asks for yourselves in applying for any sort of funding is to be really able to demonstrate how your research is making an impact, is making a difference in terms of addressing health and any social care inequalities. And therefore, this is about making inclusion a condition of the funding now, really bolstering that so that it doesn't actually feel like just a nice to have. And how can we go about doing this? Well, the standards say these things, and what Emilie and I will do is build upon this in a bit more detail for you. And first of all, what it says is the inclusive opportunity standards requires the partnerships to be accessible. So that involvement partnership, and the partnership's an interesting word, isn't it? When you think about partnership, what does that conjure up? And that's something that I'm going to hopefully leave you to also reflect upon. But it talks about the partnership being accessible. And when defining accessible, and again, I think we can build upon this discussion today, it's about including a range of people and groups with barriers, such as even the barrier to, can I even afford to take time out to take part in research? And that's about affordability. So therefore, for example, payments will become a critical issue there, but also location as well. So the things that stop people from taking part in those research opportunities, thinking more closely, and we'll come to that shortly, about how we can address this. And the why is evidence-based, because we know that actually historically research can be very skewed towards those people who are in a position to take part. And quite often they might well be white, they might be older, retired, middle-class participants, and underserved communities who might even be more so impacted by health inequalities, remained largely omitted, therefore, from the research that impacts upon them. So we're going to spend some time looking at when we think about underserved, and it's interesting that the language has changed to hard to reach, because hard to reach in the past suggested that actually there's a problem with us finding those individuals, and the problem lies with the fact that they don't want to be found, for example, rather than actually how can we meet people where they are so that we do reach them. And so we're going to have a look at that. But I'm going to pause for a moment. And as Emilie said, we want this session to be really interactive. So those of you online, please do, use the chat function. And those in the space, maybe it's time to get a conversation going right now. From your perspective, why is equity, diversity and inclusion important in health and social care, and in health and social care research? Why is it important? And we've got some hands up also online here as well. And actually, perhaps if I may, I don't know if we have people speaking online.
Sorry,
can they hear us?
Yvonne, can you hear me?
Yes, I can.
It's just there's been a comment in the chat that we just need to slow down the pace at which we're talking for the captions to catch up.
Thank you.
So just, I am a naturally very fast talker, so apologies, but just to bear that in mind.
Thank you. So we will slow down our speaking for the captions to remain aligned with us. But thoughts, anyone in the room, and also if colleagues online speak, can we hear our colleagues in the room? Definitely a shift from, definitely a strong shift from hard to reach. And I would say it's aligned with a number of public sector bodies who have used the language either underserved, or I often hear seldom heard, actually, seldom heard groups or underserved groups. And it's recognizing that sometimes when we say hard to reach, you know, perhaps it's about how we apply effort to reach those groups of individuals. So yes. Thank you so much for Olivia, for those comments and that piece around lack of awareness, but also the fact that sometimes where diversity is not in the room, we lose the ability to be curious, or we become less curious. And so also it can make work around diversity, equity, but also inclusion seem complicated. And I'm hoping by the end of the session with Emilie and myself, and let's be really clear here, we are with you for an hour. So we're not expecting after this hour that, you know, all becomes crystal clear immediately after this session. But we're hoping it will provide you with some insight into when you're thinking about who do I need to have in the room. And when I say in the room, in terms of who do I need to engage with, and why, that you get to understand that it's very much likely to be a diverse audience, a diverse set of individuals. And when we use the term diversity, and I hope you don't mind, and I know, and I'd like Emilie to come in as well, but when we use the term diversity, we have to mention, and I think I've used that word, intersectionality, because quite often we can put people in buckets, or, you know, it's, you know, PGM individuals or Black individuals, or, for example, even if we say, let's say Black women, but actually the experience of Black women might be different if you happen to be a Black woman who is neurodivergent, for example. So I think we have to be a wee bit more, I suppose, curious in our thinking about who we need to think about when we're carrying out research in terms of engagement, but more importantly, why and when, and what will you do with what they tell you? So I'm just going to pause. Any other questions? But Emilie, would you like to come in as well? And I can't see who's in the room, so apologies.
That's okay. There are 10 people, 11 people in the room. Can I count myself as well? Yes, indeed. So there are some eager people here too. So let me, sorry, my slides. And I think it's a good point about who is left out, and that intersectionality kind of piece that Yvonne was talking to. So just, I think it's important that we understand that a lot of the systems in which we're working in have, through how they came about, who had money, who had access to voice, who possibly had the ability to read, to write, who had all that time, maybe to carry on with their schooling, meant that through the establishment of a lot of the processes we work in, voices have naturally been excluded. And what that has left us with is a system where there is a lot of health inequality already kind of baked into the system. So, and a lot of the work that maybe you're doing, you might start from kind of where we're at, but it's important to recognise that you're already missing voices if you start in that kind of in that area. So just some things, and these are UK facts, but 10 years gap in life expectancy between the most and least deprived areas in England. And what would that mean in terms of maybe access to older voices in particular parts of the country, and also what doesn't that show? That doesn't show maybe the quality of health between maybe somebody who's 70 in a very affluent area and somebody who's 70 in a more deprived area of England. 18 years gap, and healthy life expectancy. So you can see that that's slightly bigger. Twice as high hospital admission rates for infectious diseases in most deprived areas. And how does that come about? Maybe due to living conditions, maybe to not being able to decide how you use your time. If we look at COVID and people that had to go into the workplace, a lot of you would have been in kind of maybe the areas in which you're working in, you would have been considered key workers. Can you step back and protect yourself in the way that maybe other people would have been able to? Maternity and maternal health, it's very much an area that has improved. I will say, when I first started kind of looking at EDI at the university, when I started working, that figure was much higher. So it's still quite shocking. And when I think back, I don't have children of my own, but I think back kind of to the stories my mum tells me about her experience of giving birth here in the UK, I just think, oh my gosh, it's horrendous. I know that Yvonne as a mother might have looked at these stats as well. So Asian women are 1.3 times more likely and Black women 2.3 times more likely to die from pregnancy-related causes during childbirth or within 6 months postpartum compared to white women. So really thinking about kind of what assumptions are we making about groups? And I think going back to Yvonne's point about the underserved rather than the hard to reach, because the hard to reach is very much gives you kind of a sense of attitudes of people, whereas underserved think, well, actually, I should be doing more for these groups, or I could be doing more for these groups. Mental health, so Black British people are 4 times more likely to be detained under the Mental Health Act than white British people. And then you might start to get a sense of some sort of behaviours as well. So would I come forward to talk about my mental health? Is it something that if you're doing a study or doing research and part of that you're asking people to talk about their mental health, are Black British people less likely to be honest about what their mental health is, knowing that the triggers might be much higher for them in terms of being detained under the Mental Health Act? Could it be that behaviours in particular groups of people we consider to be more negative when expressed by a particular group of people than others? If we think we had a very excellent women leadership event here at the university yesterday, and one of the things we talked about was gendered language. It's the idea that men can be assertive but women can be bossy. So again, that idea of aggression and it not being assertion maybe when it comes to race. Disability and long-term conditions. So women with a learning disability on average die 23 years earlier than women in the general population, which I think is a really shocking statistic. But, is that linked to maybe some coping mechanisms or some behavioural activity that happens because women are also underdiagnosed? So if it's not recognised and you're trying to navigate life with all these expectations on you, roles of, caring role whilst going out to work, and also under the lens of kind of there are behaviours that are acceptable for women that maybe are less judged in men, you can kind of understand how we might get to the point of that just without the fact that do we even include women with learning disabilities in research from the outset. Then we've got deprivation geography. So the healthy life expectancy gap between the poorest regions, richest and poorest regions has grown by 22% of men, since 2011 and 2013. So you can see things are getting worse, even though we know about these things seem to be getting worse. So how can we make them better? I think those health inequalities are really important. And I think when it comes to disability as well, it is important to understand that health and social care tends to have the medical model of disability kind of running through it. At the university, when we talk about accessibility and inclusion, we try and step away from that, but it is really hard when you're dealing in a healthcare setting to not present things or not come across groups of people that will naturally think about fixing people rather than kind of what can we do to support and to help you and to enable you to be part of the community. What barriers can we remove? So, you know, ableism is something that does go throughout a lot of these things as well. But hopefully that's kind of just made you think about where voices haven't naturally been considered to get to this point. Yeah, in the beginning when we talked about that co-creation and that partnership, I think that's where you start off, where before you even, I suppose, begin any sort of research, is about going out and looking and seeing who's in the room to begin with. That is a really, really good point, Alison.
Right. So, I mean, I wanted to just, before talking to this slide, just pick up on the really sort of points that were sort of made, particularly in the discussion about actually, you know, who's in the space and conducting research at the very beginning, and, you know, the potential of underrepresentation in terms of, you know, PGM individuals rooted at the heart of research. And I think it's something that we do need to reflect on, because we'll talk a little bit more about this shortly, but actually, if research is conducted about me, to what extent do I trust the individuals that are carrying out the research? And sometimes it's about seeing people that look like me. But if I don't see people that look like me, I have a greater sense of trust because they seem to understand what my needs might be, or allow me to have the space to tell you what my needs are. So there's something about, I suppose, owning where we are right now. And you're absolutely right. We could probably do with more diversity. But in that space of a vacuum, what do we do? And what do we all need to do as researchers? Because, as I mentioned at the very beginning, research is about all attributes that make us who we are, but what is relevant to the research, obviously. In terms of who might well be underserved, this is just, and I say the word just, a taster, because we could have a session alone on underserved communities, groups within research. But this is really, and I suppose the purpose of us sharing this data is really just for you to get a sense of who are less likely to be represented in trials, for example. That might well be ethnic minority communities, for example. But they might be more highly represented in areas, for example, around have had higher infectious disease admission rates, for example. And it's for us to just see the disparity around the data in terms of who's most impacted, but who is engaged. We can also think about people and look at this from socio-economic deprivation as well. And I just wanted to pick up people. There were some comments also in the in our chat conversations about maybe people sometimes not having sufficient time, for example, to be involved in research. And this might well impact upon people you know, who are experiencing socio-economic deprivation. You know, you might well be living in a deprived area, but holding down 2 or 3 jobs, quite low paid jobs, just to have sufficient amount of income to survive. And therefore, taking part in research becomes very challenging, you know, and hence why payment for research becomes something that we really do need to think about, particularly if we're wanting to reach those groups of individuals. Emilie has touched already upon particularly about disabled people. We know that disabled people will face structural barriers in accessing research in its own right. And there will be a number of structural barriers in terms of even the physical accessibility, right the way through to communication barriers, right the way through to attitude towards disabled people, even in terms of the conduct of that research as well. And we also know that actually older people and the way how we might frame research questions towards older people might itself make it more challenging to take part in research. And actually, despite being major users of health services, are probably the seldom heard voices. We know that when we think particularly about the LGBTQ plus people, patients, for example, they might experience higher rates of, for example, mental health, and also barriers around disclosure in those clinical settings. And that can impact upon their sense of trust and the degree of comfort in accessing and taking part in research too. Gypsy, Roma and traveller communities, and a little bit of a historical history towards who I am. And I worked in a public authority where they had a higher proportion of Gypsy, Roma and traveller communities. And one of the disparities that was a known experience was the inability to even access medical health due to the discrimination they faced at the point of accessing it. And it tended to be the receptionist. That was the person that held the power that actually made it difficult for people to even register, for example, with a GP. And we know in terms of many outcome, in terms of the kind of health indices, we know that Gypsy, Roman and traveller individuals will have experienced one of the greatest inequalities, and particularly the measures around life expectancy as well, and that connection to higher chronic illness. And probably one of the least involved in research, and for perhaps a number of reasons as well. And actually one of the reasons might well be around trust as well. And we know that equally refugees and also asylum seekers, will have other vulnerabilities. They might well have and do experience trauma as well. And so we know, therefore, these are just a snapshot of underserved communities. Some of these communities are protected by the law, by the Equality Act, where we have a duty to to not discriminate directly or indirectly against these individuals. But some of these individuals don't have protection against the law. So, for example, what about sex workers? We haven't mentioned those individuals. What about people experiencing homelessness, for example? What about those people within the criminal justice setting as well, or those living in rural communities? So when we think about underserved groups, I'm hoping that actually we think about people not only in terms of I describe primary identities, the things about us that we can't change. It's who we are. It'd be very difficult or impossible to change. I'd like us to think about secondary aspects of our identity, so more based upon our upbringing or our socioeconomic setting, which might also include aspects around religion and belief as well, right the way through to, our educational background, our literacy background, digital literacy background as well. Broaden out our thinking, and even people that we might think about particular cultures, even attitudes towards power and authority, and who's less likely to be openly attracted to being involved in research as well. And it might mean we do something different to access those groups and individuals.
Yeah, I just wanted, if it's okay, everyone, just to kind of tie back to the point that you made earlier on about intersectionality. And I think if you look at all of these underserved groups, and if you think about a person that you might have come across or a person you might know, if they are, I don't know, somebody that would fall into this category of being somebody in an area maybe more socially deprived and disabled and part of the LGBT plus community, you quickly see how the barriers that present for this group, they are then barriers for that group and for this group. So they do kind of they do layer on top of each other. So going back to the intersectionality piece, where who are the underserved groups, there will be people within those groups that, again, slightly more underserved. I think also, Yvonne, you've mentioned payment. I'm going to say it now because otherwise I might forget. But when we think about payment, it is also who can receive payment. If you think about disabled community at the moment, when you think about kind of PIP and access to benefits, a lot of communities, unfortunately, that are disabled might be reliant on funding from the government in order to pay for services or be able to access services. If you provide them with money to access your research, what does that do to their ability to be able to access the things that they depend on? If you think about the refugee and asylum seekers, if you wanted to pay them for their time, again, what does that do in terms of them being able to access, if they're able to accept the payment? How are they able to access the other sorts of finance they might rely on? And kind of ethnic minority communities at the University of Portsmouth, we have our staff networks, and often something that comes up in kind of, I suppose, our staff network attached to ethnic minority is around banks, quite often being more interested in particular people's bank accounts and transactions than they would do other groups of people. So it might be that sort of like one-off payment might be slightly more problematic for particular groups of people. So I think it's about putting yourself in the shoes of somebody that would be parts of those other groups. The older kind of generation, one thing that I definitely do with my parents, and I don't know if you do with your mum, is I'm often telling them, like, beware of scams, beware of scams. If somebody offers you money, like, don't take it. Don't, the moment somebody's trying to offer you something for nothing, like, stay away. So again, if you're looking to involve somebody in research, it's really important you think about actually why might these groups of people be underrepresented, or parts of these groups will not be part of research. So yeah, I just wanted to.
Can I just flag a comment from the chat as well? There was a question here. We were talking about the acronym PGM.
Oh yes.
The global majority.
This is another.
and it starts with a discussion. Is it the most current and best term to use? So, is there any literature about this, please?
Yeah, I'll hand over to Ron, but I just want to say that one of the things that we open every sort of EDI talk with is, and from a healthcare or social care position as well, you're probably the same, that acronyms are exclusionary. The moment you start talking in acronyms, people are like, and we've done it ourselves, so apologies for that. But yes, people are the global majority. Yvonne, do you want to give a bit of background as to why we use people of the global majority here at the university?
Thank you so much for that point also in the chat. Brilliant, thank you. It's an interesting one because actually, as we know, as Emilie said, acronyms are so exclusionary. But what we do know that the term BAME, or quite often was called BAME, we found that actually when we engage, particularly with those communities that those terms refer to, people actually found them most unuseful. They found that it felt like they were being categorized into these 4 particular groups. And particularly the word at the last bit, ME, minority ethnic, again, people disliked the term being a minority, and quite often said, I prefer the term being minoritized. We, as a university, have a very vocal, active group of students within our student union. And after, I think, this conversation, and correct me if I'm wrong, Emilie, the kind of notion around acronyms about how we describe ourselves at the university came to the forefront way back at the time of the killing of George Floyd and the rise of the Black Lives Matters. And a number of students said, look, we're not comfortable with the terms BAME or BAME, and nor were we, quite frankly speaking. But we had a discussion around what do students feel comfortable? How do you want to define yourselves as a group of, I'm going to use the term black and brown people in terms of what I can see in the chat function. And people said, well, actually, we want to get that sense of net worth and value. And if you think about net worth and value from a global perspective, we are a majority. Yes, we might be minoritized in the context of where we are, in the context perhaps in aspects, parts of the UK, but actually we're a majority. And so our students first of all adopted the term people of the global majority. You might see global majority people. But and I think after that, our colleagues, our colleagues in terms of employees, also adopted that term. But when we are report writing, we are specific. If we're talking about Black colleagues, we're talking about Black colleagues. If we can be more specific, we might be talking about students, particularly our Nigerian students, and we'll be specific. And I think that is what I'd like to say, and I think I've tried to allude to. We ought to be as specific as we can be when we're talking about individuals. But we use this term, and I think you're right, it is a catch-all term, which is sort of what BAME was in the first place. But it's a catch-all term that people find more empowering than the term BAME or BAME. So I hope that kind of gives you some context that this is very much student-led and colleague-led as well. And so it's a term that we've adopted, but we like to be, and I think as researchers, not like to be, we must be as specific as we can be.
Yeah, it also, I think, with the term, and to take it back to kind of what we're talking about, is that thinking about people of the global majority makes you think, well, actually, if so many of the population of the world belongs in this group, why is all the research about this particular group of people, and why are all the papers written by people that maybe come from this particular heritage? So it just, I think, in terms of what it is that we do, by reminding ourselves that, healthcare, social care isn't unique to the UK. It is something that is global, and people fall ill, unfortunately, across the world. Why is a lot of the research that we access or we reference by particular types of people? So that kind of anchoring back to where the gaps might be.
Is PDM used in other settings beyond the UOP? Global majority, yes, I've seen in many settings. Sometimes PDM, people of the global majority, but definitely global majority. And I'm even seeing that more used in sort of government type body writing as well now as well. Yeah. So Emilie and I are just going to now sort of take you through the kind of 6 principles that apply to any sort of funding opportunity. And I'm just going to touch on the first one, and then I'll hand over to Emilie and we'll move on that way. So partnerships are about, as I mentioned at the very beginning, about being accessible and including a range of individuals. And Emilie's already given you that insight into barriers that might be related to payment as well. And I know, for example, I've come across research where, because of all the areas that Emilie's alluded to in terms of people sometimes cannot receive financial reward, that they receive rewards in terms of vouchers, or in terms of a thank you gift, or in terms of even seeing people being given food hampers, because actually that was something that was more meaningful to that individual and was more readily accessible to them too. But we can also think about location. We can think about the language we choose to use as well. And you probably have come across conversations around using plain English. We've been told to slow down, even slowing down our pace and tone in terms of language becomes important as well in terms of face-to-face engagement. But the fact remains is we need to pause and think about who is it we're trying to reach first, and how is the most inclusive, accessible way of not only reaching them, but ensuring that they can take part as well. So if I move the slides forward to working together, Emilie.
So working together, I think if we go back to the co-creation, that collaboration piece at the beginning that we were talking about, you might want to look at your partners in terms of working together based on values. So are you working with a community group that maybe has a particular set of values? There are lots of people that work with underserved communities, but you might want to think about, do your values align? Can you support them in achieving their values. The partnership, so the collaborative working, it might also be that a partnership isn't a 50-50. So if you're inviting somebody to be part of this co-creation, you might have to be as the person with the knowledge, the access to funding, the person that is going to get a lot out of possibly this research in terms of, I don't know, being able to publish something, so that might lead to promotion. You might have to do 90% of the work, and they might only, I say only, their contribution might be that 10%. But actually, would your research be of any value without their voice? You might also have to think in terms of how risky is it for that group to be part of that research. Some of the things that we talk about, definitely in EDI, is we want to be data driven, we want to be data led. But if we ask people, going back, I think, to the example of kind of Black British people more likely to be, I want to say section, but I don't know what it said on the slide, under the Mental Health Act. Is it more risky for somebody to be part of that group and to give of themselves and to be visible? Sometimes visibility is a luxury or a privilege that some groups aren't able to have. And we think about the laws at the moment around LGBT plus and specifically around trans inclusion. If you're trying to work with groups of people in that space, how difficult might it be for those people to come forward, especially if, you know, they might have transitioned decades ago, to come forward and talk about maybe some of the healthcare issues that they might face based on their particular circumstances. So that working together can look really different. And I think sitting in, taking that time to really think about what that might look like for different groups of people is really important.
And I think time is the key, really, because time and planning becomes crucial when we're talking about meaningful engagement. It might be for some of the people that you are seeking to reach, it might be around digital competency, for example. It might just be around that sense of confidence to speak. It might be that you will need to think about what additional support and learning can we provide that will build confidence and skills for public involvement. It might be that you're choosing to work with a particular community group. And it might be that you utilize that community group to access particular individuals that you're going to be involved in research with. Well, actually, what skills do we need to perhaps even work with in terms of that community group to even equip them to publicly engage on our behalf? To find those participants and to secure goodwill from those participants as well.
And then looking at kind of governance, leadership, the decision making of your partnership or your collaborative approach. Have they been part of the establishment of the scope of the work? Do they know what's going to happen with it afterwards? Is there some sort of protection over outcomes that come around because of it? If it's published and used elsewhere, will they be accredited or acknowledged for that as well? So the governance piece is really important in order to keep people safe after the fact.
And I think I've touched upon this in that initial inclusive opportunities, but the plain language for well-timed relevant communication as well as part of those involvement plans. It is about planning. It is about the time when you seek engagement. And it might be that sometimes you're going to have to provide a range of engagement opportunities, recognizing that for some individuals, they're not going to be able to access that opportunity solely because of the time and solely because of the location as well, or solely because it's purely digital and accessing sort of digital communication is challenging for that individual.
I think the time element as well, in terms of the time of year and what else is going on, in somebody's life. When we think about everything that's going on in the world, if you were trying to reach to work with groups that maybe have links to parts of the world where it is so kind of precarious or dangerous, would they really want to be engaged in the research they're doing? Would they prioritise that over other things they're doing? Would it be right to expect them to prioritise those sorts of things as well at the moment? With Eid coming up, really thinking about what else is happening in groups' lives as well. And then impact. So evaluation is really important when it comes to making sure that your research has been as inclusive as possible, or the activity that you're doing is as inclusive as possible. And the impact can look really different depending on kind of why somebody has come into that partnership or as part of that co-creation, I suppose. So it could be, I know I've heard of researchers that maybe have produced literature or really tailored education packs for groups of people. And that, just the creation of that and somebody accepting it and taking it and saying, yes, I'll share it, that could be impact enough. If you're looking at evaluating the work you'll do, it's really important. If you're asking somebody's opinion, we've all been there, you go somewhere, somebody does something and they ask you your opinion and they do nothing with it. If you want to keep building up a kind of a long-standing, really valuable relationship with a group, it's really important you act on it. And if you can't act on it, because sometimes we can't, that you explain why, and you make that almost as clear and as visible as the work that maybe you've undertaken together. So that impact and evaluation, I think we are keen to measure things, especially probably in the work that you do biometrics. So looking at the qualitative data and the quantitative data rather than the kind of the qualitative stuff that you might get back. And that impact and evaluation is really important.
What I'll say is very conscious of time, so I'm not necessarily going to go through every one of these, but you can look at these in your own time. But the key message is really this: we are asking communities to put their trust in you as researchers, but we also have to acknowledge why they might not, why they might feel less inclined to. And these are just a couple of situations in terms of studies that occurred over the last, starting from 1932 all the way up to today, where people have been involved in research and it hasn't been due to their knowledge, so they had no knowledge that they're actually part of that research, for example, or they've experienced harm from that research as well. But the key rationale to all of these is really this: the harm that people experience through the study itself ripples out, and it ripples out into the context of where we are today. If we think about the diaspora, the communities that were impacted by a number of these studies, you might well think, well, actually, how has, for example, the Tuskegee syphilis study, which was mainly about administering withholding treatment, particularly to Black men who had syphilis. And what happened afterwards was a number of them died, went blind, or suffered severe illness, for example. And you might say, well, actually, how is it that that's rippled across the communities? Well, actually, it's cited in the generation. So there's a generational impact that people are actually recognizing, this sort of evidence of medical research that has engendered great distrust, and not only amongst Black men, but also amongst the Black community. And you can see how that therefore has impacted even upon the COVID-19 vaccine, for example. And so just because of the benefits of time, what I'm wanting us to understand, that there is a footprint of distrust that can be passed down from one generation to the next. And therefore, winning that trust is about actually being honest about what your research is that you're doing, what the parameters are, what you can and cannot do. And as Emilie said, sharing what's come out of that research and citing and acknowledging the individuals if they choose to be acknowledged. Acknowledge the individuals that has impacted upon the research and the outcome too, and reward them appropriately.
So based on what we've been talking about, hopefully you've got some indication of what you might like to do. And I feel like you might have thought we were going to give you some sort of silver bullet as to like, this is what you can do to make sure it's inclusive. It really does depend on the groups that you are trying to work with or the research that you're doing. But I will say that there are things that you can do in terms of asking the right questions before you start going. I think Yvonne mentioned time being something that's really important, making sure you give it enough time, the planning stages of things, and involving as many people, I think, in that planning stage as well. So who's most affected by the research question that I'm developing? Not just the people that are going to do the work. And I think also to Yvonne's point about the generational footprint, you might be the people most affected by the research you're developing might be 18 to 25-year-olds. But who is influencing those people to participate in the research? You know, would you need to change the hearts and minds in terms of, yes, it's really important that you get involved with it, with parent groups as well. So although your group, your research might not take into consideration one particular group, in order to get them involved or take on the research, the answers to research, you might want to think about that as well. Are communities currently represented in my network? If not, why not? You know, why is it they're stepping away, and how will you reach them? What barriers might exist to their involvement? So I think we've talked a lot about those, and Yvonne definitely gave some suggestions there. Have you budgeted for proper payment? And have you completed? There's some public involvement training I think you can complete as part of the funding. Do you want to go through the other ones, Yvonne?
Yeah, do you want to put them all up, Emily, and I'll just run them through, as you said, as a collective. And then I suppose this is all about designing your activities. So now that before you apply, whilst you're designing your activities, obviously there'll be, to access any funding, there'll be an assessment around your application. But I think this is just a message, and this is just a matter of good course, really. Involvement should happen at the design stage and not after you've written your kind of proposals. So actually, so that even the proposal themselves are informed by the people you're seeking to reach. Plain English, we've mentioned that before. We've mentioned about accessibility of venues and communication. I love the idea. I just want to give shout out to Kate, who also spoke about actually leaning in on the communities to up and skill and train us and train you as researchers. You know, that can be also part of this design element as well. Tracking who you involve, who is involved, and why, most importantly as well. And you've got a toolkit there to capture and communicate impact. What difference is it making, and what were the limitations?
Think you. I will say very quickly, when it comes to accessibility, I was just conversation that Amy and I were having beforehand about what's it called? The hearing loop, the portable hearing aids. If you know that you're going to want to include people that might require maybe additional steps, I suppose, in order to get into the space, be it a physical space or a psychological space or a virtual space, it's really helpful if you can do some of their work first, rather than asking somebody kind of, definitely ask people what they need, but where do I source it from? All that sort of stuff is the labour that we should be taking on, rather than, so that communication piece might be that you have to provide whatever it is that you're producing in lots of different formats, and making sure that if people need additional, then they're starting from a slightly higher point, rather than coming into a space and feeling, number one, they don't possibly have as much power as you. Also, maybe they feel like they are then being demanding, even though they're not being demanding, and just after the same level of accessibility. So I think here, is just a point in direction of maybe some of the work that we're doing at the University of Portsmouth and ways in which we can help you showcase some of the outcomes of your research. So, for example, Yvonne is heading up our Race Equality Charter submission, and the best practices that we have around racial equity and things that we've done in the workplace or maybe for our students. And by that, not just in the classroom, but outside the classroom. So things like well-being, engaging in sport, maybe mental health as well. We are able to share those with other institutions. So it is hopefully a way for you to share some of that research and best practice. Athena Swan looks at gender equity, and much the same. Lots of universities, not just in the UK, but across the world, will engage in Athena Swan and will be looking for activities that promote gender equity. We have a group of PGM ambassadors, the people of the vote majority ambassadors, that Yvonne, that they report into Yvonne, and they might be of use as well. If you're trying to get some of your research out there, they might have some ideas around how it could be more accessible. There's some really good resources on the research pages of our website. We have an access and participation plan as well, so that might give you some stats around hard to reach or underrepresented or underserved groups. And then the NHR research inclusion funding information there. But that is it. I've realised that we have overrun by a bit, so apologies.
Thank you, Emilie and Yvonne, for that very helpful webinar. So just to follow up to say that this is the first seminar in a series, so there is a second. Oh, the screen is flickering in the room here. We have a second seminar on public involvement case studies, which is taking place on the 12th of June. At the same time, same venue, there'll be an online option as well. We have three wonderful speakers, Martha, Jenny and Chris, three ladies who are going to be talking about their public involvement experience and the impact it's had for them around the theme of ageing and dementia. So do come along to that if you can. And yeah, if anyone has any extra questions, put them in the chat and we can follow up after the session here in answering those as well. So thank you, everybody, and you're free to leave.